I want to show you how to make a ClinCheck more predictable when it comes to adult treatment that is aesthetically oriented, which is what a lot of our Invisalign cases are, especially with adults. So here we have a nice alignment of the teeth, but the patient is positioned like you see here. And our plan is to improve the alignment, close the space distal to the upper right tooth. Everything you see here looks very manageable. And so there's no problem with this path of treatment. It should be very successful. But when you look at it in this view, I want to show you a couple of things that will allow you to get that final result efficiently. Because some doctors will say that Invisalign leaves things a little bit short of the mark and you have to do numerous refinements. Now, I'm purposely not showing you the lower arch because I don't want to make this about the patient's bite or the occlusion. I want to focus on the movements of the upper anterior teeth. Now, remember, when I showed you in the occlusal view, everything looked reasonable. But I want to show you in this way the ClinCheck came back to me. You notice the dark triangle that's there. The reason why Invisalign is programming something that will result in a dark triangle is the wear on the incisal edge has left these teeth to be not parallel. So the program has things leveling out. However, if I look at the pan or if I look at the root angulations or if I just trace them from the crown anatomy right now, those roots would be reasonably parallel right now. And so really accounting for the incisal edge isn't really something that we need to do here because this patient is probably going to need bonding anyway. And so I'm not going to focus on getting those incisal edges level because I don't think we need to move the roots to that extent. So that's one thing. And I'm going to show you how I make that change. Also on this lateral incisor, notice there's some extrusion, but the patient clearly needs bonding. Now, the question is the gingival margin. If the patient's lip line does not reveal that the gingival margin of the upper left tooth is superior to the gingival margin of the right lateral incisor, there's no need to extrude that tooth. And even if you did want to extrude it, if you look, you're going to see the dark triangle develop. What that means is that the root is being moved distal on this tooth, but there's no need for that in this case. So I'm going to make that root be in a situation where I'm extruding it without the added complexity of the distal root angulation. And then here, I'm going to simply make the roots stay in the same mesial-distal position so that I won't have a dark triangle and I won't need attachments on these teeth. And I'll be able to still accomplish what our main goal is and leaving that very slight slant to the incisal edge and go about it that way. And explain to the patient that if they want the edges to be level, then they can do some bonding on those teeth. Because aesthetically, the limiting factor for this patient is going to be the length and the character of the teeth. And getting this edge level on a tooth that already is got significant wear is not going to make a big difference. And now I'm taking this case and making it a lot more predictable without the need for attachments. I think I also, as I look at this, I'm going to decrease some of the intrusion of this tooth. Okay, now I have a much easier ClinCheck and I'll have a much more predictable treatment without attachments.